Our nation's nursing homes and assisted living facilities have been terribly hit hard by the COVID-19 pandemic, suffering over 100,000 deaths. The numbers continue to rise in these long-term care facilities, accounting for a staggering 40% of the country's coronavirus deaths.
Now let's bring in the president and CEO of the National Healthcare Association and the National Center for Assisted Living, Mark Parkinson. Mark, thank you so much for being with us, and give us a sense of where things stand right now at this country's nursing home and assisted living facilities. How bad is it right now?
Well, unfortunately, our worst nightmare has come true. As COVID has spread like wildfire across the country, it's found its way back into long-term care facilities. So, last spring, when we thought we had seen the absolute worst, we were averaging and peaking out at 10,000 new cases in long-term care buildings a week. We worked hard. We cut that number in half to about 5,000 a week. Unfortunately, the most recent data now show over 15,000 new cases every single week in these buildings. And the tragedy is that we know that about 20% of people in long-term care that get COVID will die. So we're looking at, in the future, 3,000 deaths a week until we get past the vaccine.
Until we get the vaccine. We keep being told help is on the way. There has been some encouraging news about the vaccine and when it's going to roll out. The CDC meeting and going to give recommendations, meeting today, and going to give recommendations about the order, the priority, who should be getting the vaccine first. There's no debate, really. Healthcare workers should get it first. But also, in that priority group, do you believe certainly long-term care staff, nursing home staff, and residents should be on that priority list?
Yeah, it is absolutely critical that the CDC decide today that not only healthcare workers, but also the residents of these facilities should be at the absolute top of the priority list. As you indicated as you came into the segment, 7% of the COVID cases have been from folks in long-term care buildings, but it's 40% of the deaths. So if we can pull together as a country and in the next 60 days, vaccinate all of these residents, we can cut the death rate almost in half. And so we really hope that the CDC makes that right decision today, and then that the governors who are not bound by the CDC recommendations, just a recommendation, we hope that they will do the right thing and make sure that all of these residents get vaccinated immediately.
And speaking of recommendations, the Trump administration last month made some new recommendations for staff and for residents of these long-term care facilities, saying to avoid contact with relatives during the holidays. But I'm hoping you can speak to the problem with that in terms of the negative impact on the mental well-being, which can lead to the physical issues for so many of these residents there.
It's really tough. I spent a lot of years of my life on the floor of assisted living facilities and nursing homes, and the residents need their relatives. The staff, end up falling in love with these residents and do everything they can to make them feel comfortable and at home, but there's no substitute for their kids, their grandkids, their spouses. And unfortunately, they've now been isolated for about 8 months. It's another reason why it's absolutely critical that we get this population vaccinated, get this nightmare behind us, and rejoin these residents with their loved ones.
Beyond this, are you going to see some potential, but beyond just the health and care for these folks, are we going to see potential closures of long-term care facilities, nursing homes, because there's not enough some relief coming, in particular from Congress, in some type of relief package? Is that a possibility of seeing some mass closures?
Yeah, unfortunately, it is. This has been a clinical nightmare, and we know that, but it's also been very bad on the business side. Census in these buildings has dropped dramatically. Expenses have increased significantly. And although there has been some good help from the federal government, we need a new stimulus package. They haven't passed a stimulus package now in about 7 months. And as you know, there's a lot of infighting that's occurring. The whole country, for a whole variety of folks, needs a stimulus bill to pass. And we're certainly a part of that. And without it, there will be more closures of these facilities.
Yeah, and this is such a critical issue for so many families in this country. President and CEO of American Healthcare Association and National Center for Assisted Living, Mark Parkinson, thank you. We certainly appreciate your time and your leadership.
Thank you for highlighting this important issue.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.